This is discussion 6 on the mechanisms of ventilation by Taylor Jenander. Ventilation involves both inspiration and expiration. Ventilation is also known as breathing and is described as the exchange of air between the atmosphere and our lungs. The main types of gas being exchanged through ventilation is oxygen and carbon dioxide. Before we go into how the process of ventilation occurs, we need to first understand the role of atmospheric pressure. Atmospheric pressure is the forced air that is exerted on the surfaces by molecules in the air. In order to understand atmospheric pressure better and its role in how we breathe, I'm going to discuss Boyle's law. Boyle's law is a gas law that can be defined as the following. In a closed space, pressure and volume are inversely related. As the volume decreases, the atmospheric pressure increases, and if volume increases, the atmospheric pressure decreases. In the equation shown, P represents the pressure of the gas and V represents the volume of the gas. In the examples I made below, we can use the balloons as a representation of our lungs. When climbing up the mountain, we begin at the base of the mountain. The base of the mountain contains high atmospheric pressure. At this location, the volume of our lungs in the balloons is small. As we climb up the mountain further and further, the pressure starts to decrease, and because of this, the volume of our lungs and the balloons increase. The opposite will happen to our lungs and the balloons if we were to climb back down the mountain. Now that we discussed the importance of atmospheric pressure, we begin to discuss the mechanisms of ventilation. Ventilation involves the inspiration and expiration, otherwise known as inhalation and exhalation. The next slide will show us some of the structures that are used to make the process of breathing possible. First, we have the trachea, which is commonly referred to as our windpipe. The C rings that make up the trachea help provide support so it's able to act as a passageway for air to flow to and from our lungs. Next, we have the main bronchi. There are two, one that goes into our left lung and one that goes into our right lung. They are responsible for carrying the air into and out of our lungs. Another important structure is our diaphragm. The diaphragm is very important in ventilation. It is a muscle that is located between the thoracic cavity and the abdominal cavity. It helps increase and decrease the space in our chest cavity during the process of breathing. Next, we have the pleural membrane. And it is a membrane that surrounds the lungs and also lines the thoracic cavity. Pleural helps create a pressure gradient so that the lungs can expand during inhalation. It also helps in preventing infections from spreading throughout the respiratory system. Two other structures that are not pictured above are the external and internal intercostal muscles, but we will go into what those are and how they help in the process of breathing later in the slides. During the process of inspiration, also known as inhalation, the diaphragm, which is inferior to our lungs, contracts and pulls downwards. When this happens, our chest cavity enlarges in order to have the ability to fill our lungs with air. The external intercostal muscles also contract, and during that contraction, our ribs will move both upwards and outwards. The atmospheric pressure outside our body is greater than the air pressure within our lungs during inspiration. Because of the difference in pressure, air is sucked into our lungs, which in the example in our slides from our professor, she compares it to a vacuum. On this slide, we are able to visualize the process of inspiration. First, our diaphragm contracts, and our chest cavity increases in volume. When our diaphragm contracts, it is pulled downward. When this happens, the air enters through our nose or mouth. It then flows through our pharynx and larynx and enters our trachea. The trachea is split into two more into two main bronchi. One main bronchi leads into our left lung and the other leads into our right lung. The air is now located within our lungs and the process of expiration will now occur. During the process of expiration, also known as exhalation, the diaphragm, which is again inferior to our lungs, relaxes and pulls inward. When this happens, our chest cavity decreases in volume. In order to push the air out of our lungs, the internal intercostal muscles located between the ribs also relax, and this assists in decreasing the volume of our chest cavity as well. The atmospheric pressure outside our body is less than the air pressure within our lungs during expiration. Because of the difference of pressure, the air is forced or pushed out of our lungs. On this slide, we are going to be able to visualize the process of expiration. First, our diaphragm relaxes, and when our diaphragm relaxes, it moves upwards into our chest cavity. This causes the chest cavity to decrease in volume. As the space in our chest cavity decreases and gets smaller, air is forced out of the lungs and into the main bronchi. It then flows through our trachea, our larynx, and our pharynx, also known as our windpipe, and out through our mouth or nose. Once the process of expiration is done, it is time for inspiration to start again. The cycle will repeat itself, and this is how we are able to breathe. This completes discussion 6 on the mechanisms of ventilation.